Right. So still looking at all the possible birth injuries that babies could sustain as they transit from the inside world to the outside world. This one is what is known as a cephalohematoma. All right, cephalohematoma. So a cephalohematoma is just bleeding, under. You can see that you have the skin, you have the fatty layer of the skin, then under the fatty layer, as the blood vessels there. So as the baby is passing through the birth canal might hit their head and all of that. So you might have some of these bleedings coming up. So it's a birth-related injury. This is where blood collects between a baby's skull and the periosteum. Do you understand? So the bleeding is between the skull and what? That layer of the bone that is outside. Okay? So it's usually caused by pressure or trauma, right? As the baby is actually coming through the birth canal, so many things can result into this. Things like what? Maybe they use forceps or vacuum assisted delivery. I've spoken about that. Maybe there was so much pressure in the birth canal or from the pelvic bones. Maybe the baby size was so large. All right, multiple births. All right, and all of that. Then epidural use. All right, maybe they use anesthesia on the mother, so the mother was not feeling pain, so was just pushing recklessly. It can harm the baby. So this is a vacuum extraction that I was telling you guys. So there's also one forceps. It's like a fork, they put it here and they drag the baby out. Any one of these could basically injure the baby. So how it appears is it's a raised bump on the baby's head, often at the back. Appears hours to days after birth. Does not cross the suture lines. May feel firmer over time as blood calcifies. Can develop a catarrh-like appearance as it heals. Okay, so diagnosis is just physical examination. You have seen it, So you might also want to do imaging to see if there's any damage to the skull. Okay, if skull fractures is what suspected. So treatment is what you can just observe to see if it resolves in a week. Phototherapy if there's breakdown of red blood cells leading to jaundice. The blood transfusion if the baby has lost so much blood due to bleeding. Antibiotics if you are suspecting that infections will come on. There's sometimes if there's surgeries, if you can do surgeries if there's a risk of what calcifications or a risk of deformities coming up.